my name is Nicole Velasquez, and this is my project on migraine for public health biology. According to Merriam-Webster, migraines are a condition marked by recurring moderate to severe headache with throbbing pain that usually lasts from 4 hours to 3 days, typically beginning on one side of the head, but may or may not spread to both sides, depending on the person. Migraines are often accompanied by nausea, vomiting, and sensitivity to light or sound. Migraines are also sometimes preceded by an intense aura and is often followed by fatigue. The extreme pain that migraines can cause approximately affect 12% of the population. They can, migraines that is, be preceded or accompanied by sensory warning signs and other symptoms. Migraines tend to affect people aged from 15 to 55 years old. Some people who experience migraines can clearly identify the triggers or factors that cause the headaches, such as allergies, light, and stress, as stated before. Many people with migraines can actually prevent a full-blown attack by recognizing and acting upon the warning signs. We will further go into the over-the-counter medications that can eliminate and reduce pain, and specific medications can help some people with migraines. As stated before, auras is another example of the types of migraines with or without. We will further go into that later into the presentation. A further explanation. Migraines tend to occur in more than one family member and is of uncertain origin, though attacks appear to be associated with dilation of an intracranial blood vessel and release of serotonin and other inflammatory substances. It is suspected that they result, migraines, that is, from abnormal activity in the brain. This can affect the way nerves communicate, as well as chemicals and blood vessels in the brain. Genetics may have someone more sensitive to the triggers than can cause migraines. There are multiple triggers that set off migraines. We will go into those later into the presentation. In this presentation, I will be going over the types of migraines, reasons people get migraines and migraine triggers, symptoms, treatments, migraines versus headaches, a Venn diagram chart, migraine rates in the US table, and a quiz. There are two main types of migraines, migraines with auras and migraines without auras. This classification depends on the individual experience of any disturbing senses leading up to the migraines. These disturbances of the senses are known as auras. Auras are a warning of an upcoming headache, such as confusing thoughts, flashing lights, blind spots, the perception of strange sparkling or flashing lights, zigzagging lines in the visual field, difficulty speaking, stiffness in the shoulders, neck, or limbs, unpleasant smells, and pins and needles in the arm or leg. The following symptoms are unusual for a person with migraine, although they should not be ignored. An unusual severe headache, visual disturbances, loss of sensation, and difficulty with speech. People who tend to not have migraines as often would probably not notice these signs. When migraines with aura affect vision, the patient may see things that are not there, such as a transparent string of objects. They may also not see objects in front of them, which is very dangerous, especially while driving or in dangerous settings. People experiencing an aura may describe the visual disturbance as similar to the sensation that follows being exposed to a very bright camera flash. Did you know about 20% of migraine sufferers experience an aura as the first-time symptom of attack? The aura may be a pulsing star of light. Natalie Andreer, Merriam-Webster. Interestingly enough, The cause of migraines is not known yet. It is suspected from researchers that they result from abnormal activity in the brain, as stated earlier in the presentation. The following triggers are likely to set off migraines: hormonal changes in women who experience symptoms during menstruation due to changing hormone levels, emotional triggers such as depression, anxiety, excitement, and shock, and as we've stated before, stress, physical causes such as tiredness and insufficient sleep. Low blood sugar and jet lag can also act as triggers. Triggers in the diet, alcohol and caffeine can contribute to triggering migraines. Some specific foods that you would not otherwise believe could trigger migraines, such as chocolate, cheese, citrus fruits, and foods containing the additive tyramine. Irregular meal times can also affect migraines and dehydration. Medications, such as some sleeping pills, such as hormone replacement therapy, and combined contraception pills have all been named as possible triggers. Triggers in the environment, flickering screens, strong smells, secondhand smoke, and loud noises can also set off a migraine. Interestingly enough, stuffy rooms, temperature changes, bright lights, and are also possible triggers. That is why migraines are so common, because so many things can cause it and affect you deeply. Symptoms of migraines can vary in time for each patient. Some symptoms can start before the headache, immediately before the headache, during the headache, and after the headache. Although not all migraines are the same, there are typical symptoms such as moderate to severe pain, usually confined to one side of the head but capable of occurring on either side of the head, as we stated before, severe throbbing or pulsing pain, much more painful than a normal headache, increasing pain during physical activity or when straining, inability to perform regular activities due to pain, feeling sick and physically vomiting, and an increasing sensitivity to light and sound, relieved by lying quietly in a darkened room. Some people experience other symptoms such as sweating, temperature changes, stomach aches, and diarrhea. Although uncommon, this also should be noted when dealing with migraines. It is sad to say there is no single cure for migraines. This may be due to the commonality and also the differentiation in symptoms between patients. Treatment is aimed at preventing a full-blown attack and alleviating the symptoms that may occur. Some lifestyle alterations that many people don't take into consideration are getting enough sleep, reducing stress, drinking plenty of water is always a good one, avoiding certain foods that we've stated before, regular physical exercise. Lastly, they all may help reduce the frequency of migraines. Some people also find that special diets, such as gluten-free and the keto diet, may help with migraines. Although if regular at-home remedies don't help, there is always a hospital or a doctor, a professional that may help you. When given this topic of presentation, my main idea was figuring out the differentiation between headaches and migraines. They have similar symptoms and similar pain. They both may be located on either side or both sides of the head. However, headaches are described as tightness or pressure by a patient, while migraines have a throbbing quality. Headaches tend to be more chronic and steady in nature, while migraines have a physical exertion that may worsen the pain itself. In this part of the presentation, I will include statistics from various sources. Upon interpretation of my sources, in this case the National Center for Health Statistics, adults aged at 18 and older with severe headache or migraines vary in their percentiles. For example, females rate their occurrences at a 17.6 at the ages of 18 to 24, while males are at a 7.4. At the ages 25 to 44 years old, females increase to 22.4, while males increase also, but only a tad bit, to 8.8. As they age 45 to 64 years old, females then decrease to a 16.5, while males also decrease to a 7.7. Finally, at the age of 65 years old and over, females also decrease again to a 5.9, while males are at a 2.9. In total, females rate their percentiles at 16.8 and males at 7.4. It is to be noted that as age increases, severe headaches or migraine percentiles decrease. It is also to be noted from this statistic that males often have fewer severe headaches or migraines than females. This information is from the Centers for Disease Control and Prevention in 2007, a national health interview survey. Due to the great deal of people suffering from migraines every year, the research has had many positive results, such as the surgery and medications available. Despite this, migraines can be a very heavy burden on the working class of adults, especially due to the chronicity and the fact that any physical activity may worsen the pain. From the information provided from the Women's Health USA, in the United States, more than 38 million people suffer from migraines. Some migraine studies estimate that 13% of adults in the U.S. population have migraines, and 2 to 3 million migraine sufferers are chronic, further exemplifying the commonality of this disease and explaining how horrific it is that there hasn't been a cure found yet. Quiz time! Number 1. Name 2 examples of aura. Number 2. What kind of surgery may help treat migraines? A. Ibuprofen injections. B. Botox injections. C. Sleep study surgeries. Or D. There are no surgeries for migraines. Number 3. According to the Women's Health USA in 2007, what age group had the highest count of migraines over the past 3 months? A. 18 to 24 years of age, B. 25 to 44 years of age, or C. 1 to 17 years of age? How do you think you did? Number 1. There may be different answers, but what I wrote was confusing thoughts and pins and needles. Number 2, the answer was B, Botox injections. And number 3, the correct answer was ages 25 to 44 years old. Listed here are my reference list: Merriam-Webster, Dr. Helen Weberly, Taylor Dinetti, and finally the Women's Health USA 2009. Thanks for listening. Have a nice day.